The aging disguise. That's what I call it. And once you understand it, you'll never look at your symptoms the same way again. Thyroid disease is the most common hormonal disorder in people over 60. 1 in 10 older adults has it. But here's the number that should stop you cold. That's only the people who got diagnosed. The real number is higher. Because most cases go completely undetected. You're probably thinking, if it's that common, why hasn't my doctor caught it? That's exactly the right question. And the answer is what this video is about. Thyroid problems don't announce themselves. They don't show up with a label. Instead, they put on a disguise. They look like aging. They feel like aging. And every doctor visit confirms what you've already been told. This is normal at your age. But here's what that doctor is missing. There are two versions of thyroid disease, and they attack the body in opposite directions. One slows everything down. One speeds everything up. And in people over 60, both of them wear the exact same mask. The mask of getting older. That's the aging disguise. And it doesn't work alone. Because hiding right behind it is a second condition. One that attacks your immune system instead of your hormones. One that produces almost identical symptoms. One that most doctors never think to test for at the same time. It's called Sjogren syndrome. And the dangerous part is this: these two conditions overlap. They mirror each other. And they mirror aging so precisely that people go years without a real answer. The longer it goes undetected, the more damage it does. To your heart. To your brain. To your nerves. This is not a condition that waits for you to figure it out. Today I'm going to show you 6 signs that get blamed on age every single day. Signs that are actually your body trying to tell you something specific. By the end of this video, you'll know what to look for on your own body, what tests to ask for by name, and why you've been confused for so long. But turns out, the aging disguise has cracks. And that's exactly what we're about to find. I'm going to walk you through 6, symptom by symptom, with real patient stories, real data, and the exact questions to ask your doctor before your next appointment. And if you want my symptom map that connects all 6, type symptom map in the comments and I'll drop the link directly. Sign 1, cellular drain. You slept 8 hours. Maybe 9. But you wake up already exhausted. Not tired. Exhausted. Like something was running inside you all night, and you weren't invited. You push through the morning. By 2 in the afternoon, your body is done. Your legs feel heavy. Your thoughts slow to a crawl. You need to lie down just to finish a conversation. And then something else starts happening. Something you've been blaming on age. Climbing stairs takes more out of you than it used to. Washing your hair, just lifting your arms, feels strangely hard. Not painful. Just weighted. Like your shoulders are being pressed down from above. You tell yourself it's muscle loss. That it's natural. But that's not what this is. And here's why that assumption is costing you. I call this cellular drain, and it has 3 completely different causes that all look identical from the outside. The reason why excess thyroid hormone creates this kind of fatigue is that it breaks down muscle faster than the body can rebuild it. And the muscles it targets first are the ones closest to the center of your body. Shoulders. Hips. Upper arms. Upper legs. This is called proximal muscle weakness. It starts with the stairs. Then it's getting up from a chair without using your hands. Then basic tasks become impossible, not because you're unfit, but because the hormone is consuming your muscle tissue from the inside. The reason why low thyroid hormone creates a different kind of exhaustion is simpler and more total. Every single cell in your body slows down. Metabolism drops. Energy production at the cellular level collapses. The fatigue is bone deep because it is biological. Your cells are not getting what they need to function. And the reason why Sjogren syndrome creates exhaustion that sleep cannot fix is this: your immune system is attacking your own glands around the clock. That produces constant, low-level inflammation running through every system in your body, day and night, even while you sleep. You were not resting. Your body was at war. You're probably thinking, how is anyone supposed to tell these apart? They sound exactly the same. That's the problem. From the outside, they are identical. Fatigue, heavy legs, muscle weakness, all 3 conditions produce all 3 symptoms. And all 3 look like aging. The mistake people make is accepting the fatigue without investigating the cause. That mistake costs years. Years of the real condition progressing while the fatigue gets blamed on getting older. You're not lazy. You're not weak. Your body is sending a specific signal. But here's where it gets worse. The fatigue is only the first sign. The second one is something most people have been trying to solve with the wrong products for months. Type tired in the comments if this sounds familiar. I read every one. Sign 2, the gland destruction signal. Your eyes burn by midday. Your mouth is dry no matter how much water you drink. Your lips crack. Your skin feels like it's tightening around you. You wake up at night choking on dryness in the back of your throat. You assume it's the climate, or dehydration, or just what skin does after 60. But it doesn't stop there. Your teeth start breaking down despite good hygiene. Multiple cavities. Gum problems. Dental infections your dentist can't explain. Your eye drops provide temporary relief but nothing lasts. Your tongue burns for no clear reason. And now something unusual is happening on your legs. Small, firm lumps on your shins. Or thick, waxy patches of red skin. They don't hurt. But they feel dense under your fingers, and the skin over them has a strange texture. Tiny dimples around each hair follicle. Almost exactly like the surface of an orange peel. You assume it's circulation. A skin condition. Dry skin again. Here's what it actually is. I call this the gland destruction signal, because that is precisely what your body is showing you. The glands that produce moisture throughout your body are under attack. In Sjogren syndrome, the immune system targets the salivary glands, the tear glands, and the moisture-producing glands in the skin and digestive tract. The result is a deep, relentless dryness that no product corrects, because the glands doing the work are being destroyed. Eye drops don't fix it. More water doesn't fix it. Because the problem is not dehydration. The problem is that the infrastructure producing moisture is gone. In Graves' disease, the autoimmune form of hypothyroidism, the immune system creates antibodies that drive fibroblast cells beneath the skin to overproduce hyaluronic acid. This accumulates under the skin on the shins, creating those firm, raised patches with the orange peel texture. This is called pretibial myxedema. It is a specific, named sign of Graves' disease. And those same antibodies also accumulate behind the eyes, which we'll come back to. In hypothyroidism, too little thyroid hormone dries the skin broadly. Hair becomes brittle. Nails weaken. Fluid accumulates in the tissues, but not the soft fluid of heart failure. A firmer kind called non-pitting edema. The face looks puffy. The hands feel thick. Both conditions produce dryness. But for entirely different biological reasons. And because aging also causes dryness, doctors accept it. The real cause never gets investigated. Now here's something you can check right now. On your own hands. Look at your ring fingernail. Is it starting to pull away from the skin underneath? Painlessly separating at the edge? That specific sign, beginning on the ring finger, is called plumber's nail. It is a known visible marker of hypothyroidism. Now press your fingernails together face to face, like a mirror image. Can you see a small diamond-shaped gap between the bases of your nails? If you can, that's normal. If the nails press flat together with no gap at all, that is called clubbing. Clubbing points to heart or lung problems. But hypothyroidism is also a direct cause. You're probably thinking, I've had these nails for years and nobody ever mentioned this. That's exactly the problem. These signs have been on your body for months. Nobody told you to look for them. The warning is this: the longer the gland destruction continues without diagnosis, the more permanent the damage becomes. Salivary glands do not regenerate. Dental damage from years of dry mouth does not reverse. The window to stop the progression is open right now, but it is not open forever. Type DIY in the comments if this sounds like your experience. Sign 3, the mirror test. This is where it gets visual. And this is where most people never think to look, because nobody told them to. Go stand in front of a mirror right now. Face completely relaxed. Look at your eyes. Can you see a strip of white, the white of your eye, above the colored part, the iris? If you can see that white strip when your face is totally relaxed, your eyelids are being pulled open wider than they should be. Now do this. Record yourself on your phone, or ask someone to watch. Look upward. Then slowly follow a finger as it moves straight down. Watch your upper eyelid. In a healthy eye, the lid travels smoothly with the eye as it moves downward. In a thyroid-affected eye, the lid lags. The eye drops. The lid stays up. You can see white above the iris for a moment as the lid struggles to follow. That is called lid lag. And it is one of the earliest detectable signs of excess thyroid hormone, visible on your own face before any blood test even confirms a problem. Here's the reason why this happens. Thyroid hormone makes the entire body more sensitive to adrenaline. Even normal everyday adrenaline levels trigger a low-level fight-or-flight response in the eyes. In a fight-or-flight state, the body wants your eyes wide open. So the muscles holding your eyelids up become hyperactivated, even when you're completely calm. But it doesn't stop there. Now look at the base of your neck. Is there a fullness there? A swelling? Swallow some water and watch. If a mass moves upward and then downward as you swallow, that is your thyroid gland. If you can see it moving, if it's visible from across the room, it has enlarged significantly. Now try what's called the Pemberton sign. Raise both arms above your head. Hold them there. Wait. Watch your face in the mirror. Is your face starting to flush red? Are the veins in your neck beginning to bulge? Here's what that means. An enlarged thyroid has extended downward into your chest and is compressing the large veins that drain blood from your head. When your arms go up, the compression increases. Blood backs up into the face and neck. When your arms come down, it clears. You're probably thinking, that sounds serious. Shouldn't a doctor have noticed that? The answer is that most people never raise their arms in a doctor's office. And a flushed face gets attributed to temperature sensitivity, or blood pressure, or age. The aging disguise does its job, and the vascular compression behind it goes undetected. In Sjogren syndrome, the eyes are also directly targeted. The tear glands are destroyed by the immune system. But the involvement goes deeper. Visual evoked potential tests, which measure how quickly signals travel from the eye to the brain, are abnormal in 61% of Sjogren's patients with nervous system involvement. The signal is slowing down. And no one is testing for it. Both conditions are visible on your face and neck right now. Both are being missed because no one taught you where to look. The mistake is waiting for a doctor to notice. These signs require you to look first. Type eyes in the comments if you've noticed any of these. Sign 4, the brain substitution. You walk into a room and forget why you came. You lose words mid-sentence. Names you've known for decades won't surface. You read the same paragraph 3 times and nothing sticks. And everyone laughs it off. Senior moments. Happens to everyone. But this is not forgetting where you put your keys. This is your brain struggling to function. And that distinction matters more than most people realize. Alongside the memory loss, something else has shifted. You weren't always like this. You used to recover from hard days. Now small things feel enormous. You feel low without a reason. Anxious in situations that never troubled you before. Irritable in a way that surprises even you. Sometimes you feel flat. Like the emotional volume has been turned down. Your doctor asks about sleep. About stress. Prescribes something for anxiety or low mood. And moves on. But that prescription is treating the wrong thing. I call this the brain substitution, because that is precisely what's happening. A hormonal or autoimmune cause is being substituted for a psychological diagnosis. And while the antidepressant treats the surface, the real cause continues destroying the brain from underneath. Here's how each condition produces this pattern. In hypothyroidism, even a slight drop in thyroid hormone directly impairs memory, concentration, and processing speed. Forgetfulness is reported by nearly 100% of hypothyroid patients at the time of diagnosis. It is the most consistent symptom across the entire condition. Yet it is the most frequently dismissed, because it maps so precisely onto what aging is expected to look like. Here is the danger specific to people over 60. In younger adults, excess thyroid hormone causes agitation, anxiety, and restlessness. In older adults, the opposite happens. Too much thyroid hormone makes elderly patients more withdrawn, more lethargic, more apathetic. This is called apathetic hypothyroidism. The patient is not wired. They are quieter, slower. That quietness gets called depression, or early dementia, or a personality shift. Not thyroid disease. In Sjogren syndrome, inflammation reduces blood flow specifically to the frontal lobe, the part of the brain controlling focus, word retrieval, and decision-making. Cognitive dysfunction is documented in 44% of Sjogren's patients. Mood disorders, particularly depression, appear at high rates. And this is not a psychological response to illness. This is neuroinflammation, the immune system chemically altering brain function. Now here is the part that changes everything. In Sjogren's patients where the nervous system is involved, neurological symptoms, including cognitive decline and mood changes, appear before any dryness in 46% of cases. Read that again. In nearly half of all cases, the brain symptoms arrive first. Before dry eyes. Before dry mouth. Before any of the classic signs that would make a doctor think to test for Sjogren's. So the cognitive decline gets blamed on aging. The mood change gets medicated. The immune system continues its work on the brain unchecked. The warning is this: before anyone considers early dementia, and before anyone reaches for a mood prescription, thyroid function and autoimmune markers need to be ruled out. That is not a complicated ask. But most doctors never make that connection, and every month that passes without making it is a month of irreversible brain decline. You're not losing your mind, but you are losing time. And turns out, the brain is not the only system being quietly dismantled. What happens to your temperature, your weight, and your heart is something most people have already been told is just genetics catching up. It's not. Type FOG in the comments if this resonates with you. Sign 5, the metabolic reversal. You used to be warm. Now you're always the coldest person in the room. You pile on layers while everyone else is comfortable. Your hands and feet feel cold even in mild weather. Sometimes your fingers turn white, then blue, then red when exposed to cold. And your weight stopped making sense. You haven't changed what you eat. But the scale keeps moving. Or you've lost weight you weren't trying to lose. Then your annual blood test comes back and your doctor is confused. Your cholesterol jumped. It was always normal. Your blood sugar shifted. Your blood pressure, previously controlled, is rising. You assume it's diet, genetics, age catching up. But that's not the explanation. And accepting that explanation is one of the most costly mistakes people over 60 make. I call this the metabolic reversal, because what looks like your body aging out of control is actually your metabolism being chemically hijacked. Here's how it works. In hypothyroidism, the thyroid regulates body temperature at the cellular level. When hormone production drops, heat production drops with it. Cold intolerance becomes constant. Weight gain of 2 to 4 kilograms is common at the time of diagnosis, much of it fluid accumulating in the tissues. And here is the connection most people never hear. Thyroid hormone is directly responsible for breaking down cholesterol in the body. When thyroid hormone drops, cholesterol rises, sometimes by 50 to 60% in untreated patients. So when your doctor reaches for a statin, the real question is whether your thyroid has been properly evaluated first. A statin treats the lab result. It does not treat the cause. In hypothyroidism, the picture flips entirely. Metabolism accelerates. The body burns through energy faster than food can supply it. Weight drops despite normal or increased eating. The skin becomes warm and moist because blood vessels at the surface dilate to radiate excess heat. And the heart, already being pushed harder by elevated thyroid hormone, begins to show the strain. Here's a test you can do right now. Extend your hand in front of you, fingers open. Is there a fine tremor? A very slight, rapid shaking? Place a sheet of paper flat on top of your hand and watch the paper. Even a subtle tremor becomes visible this way. A tremor present when you hold your hand still, but absent when you rest it completely, is called a postural tremor. It is a visible sign of excess thyroid hormone. The same wired, jittery sensation you'd get from too much caffeine, except this one never goes away. And in older patients, excess thyroid hormone carries one additional and specific risk: atrial fibrillation. An irregular heart rhythm most people first discover on a smartwatch or during a routine checkup. What they don't know is that uncontrolled thyroid levels are one of its leading causes. And atrial fibrillation dramatically increases stroke risk. For many older patients, an unexpected AFib diagnosis is the first visible sign that their thyroid has been abnormal for a long time. In Sjogren's syndrome, a condition called Raynaud's phenomenon is directly associated. The small blood vessels in the hands and feet overreact to cold, producing those dramatic color changes from white to blue to red. It is not just discomfort. It is a sign of vascular and immune system involvement happening beneath the surface. You're probably thinking, I've had cold hands my whole life. How is anyone supposed to know when this becomes a warning? The answer is the pattern. The cholesterol jump. The weight shift. The blood pressure change. the cold intolerance, the tremor. Each one, treated alone, gets managed with a separate medication. The statin, the blood pressure pill, the beta blocker. But the pattern underneath goes undetected. The warning is this: treating the lab result without testing the thyroid first means the metabolic reversal continues, and the medications accumulate while the real cause progresses. But actually, the metabolic signs are not the most dangerous part of what's happening. The most dangerous part is what's happening to your nerves. Type cold in the comments if this sounds familiar. Sign 6, the invisible nerve collapse. This is where it gets serious. This is the sign most people are told is anxiety, or aging, or something they need to learn to live with. A burning sensation in your feet at night, buzzing or tingling in your hands, pins and needles in places that don't add up. Your heart rate spikes when you stand. You feel dizzy for no reason. You've started tripping, your balance feels wrong in a way it never did before. You go to a neurologist. They run a standard nerve conduction test. It comes back completely normal. They tell you there's nothing wrong. But the symptoms don't stop. Here's what's actually happening. And here's why that test missed it. I call this the invisible nerve collapse, because standard testing is designed to see only part of the nervous system. The part that's visible. The large fiber nerves responsible for movement and basic sensation. But large fiber nerves are not the ones being destroyed. Small fiber nerves are responsible for pain perception, temperature sensing, and the regulation of all automatic body functions: heart rate, digestion, sweating, blood pressure when you stand. When small fibers are damaged, none of that registers on a standard EMG. The test comes back clean. The patient is told there's nothing wrong. The nerves continue to be destroyed. The only test that detects small fiber neuropathy is a skin punch biopsy. A small, low-risk sample taken from the calf or thigh, measuring the density of those tiny nerve fibers under a microscope. This test is almost never ordered. Most patients never hear the name. In Sjogren syndrome, small fiber neuropathy is one of the most common neurological complications. The result is burning feet, buzzing sensations, a racing heart when standing, random sweating, heat intolerance, and digestive slowdown, all with completely normal standard test results. The patient is told it's anxiety. The nerves continue to be damaged. The autonomic nervous system involvement in Sjogren's can also trigger POTS, where the heart rate spikes dramatically when moving from sitting to standing. Digestion slows or stops entirely, a condition called gastroparesis. The patient feels full after a few bites. Constipation and bloating become permanent. Body temperature regulation fails. And for some Sjogren's patients, the collapse goes deeper still. The spinal cord itself becomes inflamed, transverse myelitis. The brain's blood vessels become inflamed, cerebral vasculitis. Patients experience seizures, confusion, weakness in the legs, loss of bladder and bowel control, and in severe cases, paralysis. Here is what makes this especially dangerous. Multiple sclerosis produces white matter lesions on brain MRI scans in the same locations that Sjogren's brain involvement produces them. The two conditions look identical on imaging. But there is a specific difference that separates them. In MS, 90% of patients show oligoclonal bands on spinal fluid analysis. In Sjogren's brain involvement, only 30% do. And SSA antibodies, a specific immune marker, are present in approximately 50% of Sjogren's patients with brain involvement, compared to only 5% of MS patients. This means that a portion of people currently diagnosed with MS actually have what's called Sjogren's. And if they are being treated for the wrong disease, the real cause is still progressing. Every day. You're probably thinking, how do I know which one I have? The answer is that you ask for the right tests by name. Oligoclonal bands. SSA antibody panel. Skin punch biopsy. These are not exotic requests. They are the specific tests that separate a treatable autoimmune condition from a neurological one, and most patients never know to ask. In thyroid disease, the neurological danger is different but equally serious. A sudden severe worsening of hypothyroidism produces what's called thyroid storm, high fever, racing heart, confusion, and delirium. It is life-threatening. And it is triggered by illness, surgery, or stopping thyroid medication without supervision. In hypothyroidism, the neurological damage builds slowly. Nerve tingling. Slowed reflexes. Deepening brain fog. And in elderly patients starting thyroid hormone replacement for the first time, the dose must begin very low and increase gradually. Starting too high, too fast, can trigger heart complications and severe side effects in older adults. This is not a minor detail. The wrong starting dose in an older patient produces a medical crisis. The wrong test. The wrong dose. The wrong diagnosis. This is where permanent damage begins. Nerves do not regenerate easily. The function lost here is not always recoverable. Early detection changes what is still possible. Late detection changes what is still left. If your scans are normal but your body keeps misfiring, ask for a skin punch biopsy. If you've been told it's anxiety but nothing resolves, ask to rule out Sjogren's before accepting any final diagnosis. These are the exact words your doctor needs to hear from you. 6 signs. 1 hidden overlap that connects them all. Cellular drain. The fatigue that sleep cannot touch because your body is at war while you rest. The gland destruction signal. The dryness that no product fixes because the glands producing moisture are being destroyed. The mirror test. The iron neck signs visible on your own face that nobody taught you to look for. The brain substitution. The cognitive decline and mood shift being treated with antidepressants while the real cause progresses. The metabolic reversal. The cholesterol, weight, temperature, and heart changes being managed with medications that treat the result instead of the source. The invisible nerve collapse. The burning, buzzing, and autonomic dysfunction being told is anxiety by tests that cannot see the nerves being destroyed. This is not random. This is not aging. This is a pattern. One that connects Sjogren's syndrome and thyroid disease in ways most doctors never pause to consider together. And it has been hiding behind the aging disguise, on your body, in your labs, in every dismissed appointment, for a long time. Look at the comments. You'll see it. Tired. Dry. Eyes. Fog. Cold. People just like you. Who've been dismissed. Who've been told to wait and see. Who've been handed prescriptions for the symptom while the cause kept running. The next time you sit in front of a doctor, you have the right to say this specifically. These symptoms feel connected. I want to rule out Sjogren's and thyroid involvement together, not separately. Could this be autoimmune rather than just aging? I've read that small fiber neuropathy doesn't show on standard nerve tests. Can we discuss a skin punch biopsy? I want to understand why these symptoms are all happening at the same time, not manage each one in isolation. Write those down. Bring them with you. You do not need to be aggressive. You need to be specific. Specific patients get answers. Vague patients get wait and see. One more thing before you go to that appointment. If you take a biotin supplement, also called vitamin B7, stop taking it at least 2 days before any thyroid blood test. Biotin interferes with thyroid lab testing in a specific way. It makes your results appear as though you have hypothyroidism even when your thyroid is completely normal. TSH appears artificially low. Thyroid hormone levels appear artificially high. The result is a false reading that leads to a completely wrong diagnosis and potentially a wrong treatment. Most people taking biotin do not know this. Most doctors do not ask. 2 days off biotin before your blood draw. Write that down. I built something to help you prepare for that appointment. It's called the symptom map. It breaks down all 6 signs and shows you exactly how each one appears in thyroid disease, how it appears in Sjogren's, where the overlap is, and what tests to request by name to separate them. Type symptom map in the comments. I'll reply personally with the link. And it may be the thing that finally gives you the right words to walk in with. But there are thyroid warning signs we didn't fully cover today. Specific ones that appear before a diagnosis is made. Ones that escalate dangerously in people over 60 in ways most doctors are still not trained to recognize. That's what comes next. Subscribe so you don't miss it. You weren't lazy. You weren't overreacting. You weren't imagining things. You were looking at real, physical, biological signs, and no one ever connected them properly. Signs on your face. Signs on your nails. Signs in blood work that got treated as separate unrelated problems. The fact that you're still here, still searching for answers? That's not weakness. That's the right instinct. Your body has been trying to tell you something for a long time. Now you know exactly how to listen.